Welcome to Health Now from WebMD. I'm your host, Carrie Gann. Today, we're talking about a life and death matter, suicide. And before we get started, we wanted to share the phone number for the National Suicide Prevention Lifeline. It's 800-273-8255. Help is available 24/7 if you're struggling with thoughts of harming yourself, or if you know someone who is. Don't hesitate to reach out. Okay, let's get started. The headlines are all too common. A major star dies by suicide, or, like Meghan Markle recently did, talks publicly about going through a time when they felt like they didn't want to be alive anymore and realized they needed help. And there are many others whose names don't make the headlines. The person struggling with addiction, depression, or another illness. The teen who's been bullied. The middle-aged person who's lost their job or their home or a key relationship. What they all have in common is being in deep despair and not seeing another way forward. Consider these facts from the CDC. Suicide is a leading cause of death in the US. In 2018, more than 48,000 people in the US died this way. Between 1999 and 2016, suicide rates rose in nearly every state in the US. In 2016, nearly 45,000 people in the US died by suicide. And more than half of people who take their own lives, 54%, don't have a diagnosed mental health condition. And it's affecting many young people. Suicide was the #2 cause of death among people ages 10 to 34, and the #4 cause of death among people ages 35 to 54 in 2018. Many things can push someone to the brink of considering ending their life. These include relationship problems, substance abuse, physical health problems, job loss or other financial stresses, and going through some kind of crisis in the past 2 weeks or having one looming on the horizon. We're talking about this alarming mental health crisis today with Seth Gillihan, clinical psychologist and best-selling author of the CBT deck. Thanks for joining us, Seth.
Carrie, thanks for having me back.
Suicide is not new, but the rise in cases is really shocking. What do you think are the factors behind this rise?
Well, it is shocking. I mean, the rise in rates of thinking about suicide and attempting suicide were already alarming in the 5 years or 5 years or so before the pandemic started, and then there's really been a sharp uptick in the past year. And I think you touched on a lot of the causes behind what we're seeing now. I mean, the the suicide really, I mean, it's the ultimate expression of despair, isn't it? I mean, the just the belief that things can't get better, that that things are intolerable as they are, and as far as the horizon is from where I can see, I don't see anything changing between now and then. And so for a lot of people, just exiting life seems like the only option. And so feeling that sense of hopelessness really is a pretty strong predictor of at least attempting to end one's life and often completing a suicide. So I think that's a lot of what we're seeing now is, over the past year, there's been so much that we've had to give up. And there's been so much uncertainty about when things are going to resolve and when life may get back to something like what resembles what we think of as normal. And so it's easy to lose hope, and if we're falling into a state like depression, our thinking often changes in ways that make it hard to see through that hopelessness and see any way out. And so for a lot of people, suicide actually starts looking like an attractive option.
Right. Hope is something we've all been a little short of in the past year. And obviously the data that we were talking about earlier is from before the pandemic, but I can't imagine how the past year has affected those kinds of situations for people.
Yeah.
Why do you think we are seeing this particularly in people who are younger than 55?
Well, it's a good question. And I mean, in general, we do see younger cohorts do tend to have, at least report, more struggles with their mental health. Uh, but but it's not like suicide is rare among those who are over 55. In fact, the rates among men are highest among those who are 75 and older. So it it is likely the case that the things that are affecting the rates of suicide are touching younger people more than they're touching older people. That maybe they're losing more. They may be at a point in their lives when the disruptions that we're experiencing in our society through changes in technology, changes uh, in economic status may have a bigger effect than for those who are 55 and older and maybe more financially secure or settled in their chosen career. Um, but it is alarming because it does seem to be the case that with younger and younger cohorts, they're experiencing more depression, more suicidal thoughts, more suicide attempts. And I mean, there's some indication that the real the biggest shift upward may have happened with the advent of a lot of social media and these technologies that they can connect us, but also quite easily lead to disconnection and cyberbullying and
Hmm.
exclusion and that kind of thing. So we don't know all the reasons, but it clearly is cause for concern.
What are the key risk factors that you want people to be aware of when it comes to suicide?
Well, the number one risk factor is if someone has made an attempt in the past. I mean, it's maybe not the most uh, interesting in a way. It's just that if someone's done it before, they're likely to try again. But it really, certainly as a clinician, that raises, a red flag when someone describes feeling suicidal and you ask, have you ever attempted before? And they say yes. Depression is a really common one, and being socially isolated too, which goes along with depression, but not having someone to reach out to, or relationships that make it feel like life is really worth carrying on with. And then we want to be on the lookout for when we or someone that we care about has experienced a major loss. So it could be losing our health, a financial loss, losing an important relationship. um, those kinds of things again can lead to a feeling of hopelessness and feeling like it's uh, not worth continuing to live. And then just being male is a big risk for completing suicide. Men are about three
Hmm.
times as likely as women to die by suicide, but women are actually more likely, almost twice as likely as men to attempt suicide.
Huh.
So, yeah. So, and obviously both of those are important indicators. So we want to be aware of access to the means. So if a person says they're suicidal, you ask them, do you have a way that you uh, have thought about using to end your life? And they say, well, yes, I do. I have a firearm. Then certainly want to try to remove access to the means that a person has.
Right. What about if you yourself are having thoughts about suicide? Or I guess if you know someone who is having those thoughts, what should you do in those situations?
Yeah. Well, so it's a really important question, and there's an obvious answer, but it's also not as straightforward as it might sound. So the obvious answer, if you're having suicidal thoughts, is to talk to someone you trust and let them know. And if necessary, to seek professional help. The complicating factor is that for a lot of people, they find that they tell someone, and maybe they've thought about it in passing, and they're upset by these thoughts and they would never want to do it, um, but they feel like they should let someone know. And so they tell someone, and the person, calls 911, and next thing they know, they're being committed to the hospital against their will. And so I don't say this to scare people and suggest they shouldn't uh, share when they're suffering in this way. I mean, and to be honest, I mean, I've lost my grandfather died by suicide before I was born. I've been plagued with pretty intense suicidal thoughts in the past when I was depressed,
Mm.
and I know when we're in that place, it's hard to think clearly, and we actually get to a point, and this is a pretty frightening place to be or to realize someone is at, when we think that not just would things be better for me if I were dead, but that the world would be better off, and even my loved ones would be relieved if I were to not exist anymore.
Mm.
And that is, I think, pretty much uniformly false. And yet it can feel very compelling when we're in the grip of it. So so it's easy when someone describes feeling suicidal to kind of panic because it's such a distressing thing to hear. And even clinicians, I think, can tend to panic because there's, I just think, so much professional fear about, I don't want to get in trouble if this person dies. I mean, I certainly don't want them to die, but there's that added layer of, am I going to lose my license if this person commits suicide, and I, am perceived not to have done everything I can to prevent it. And so that can really, I think, set some clinicians up to maybe have a hair, uh, maybe to be overly sensitive um, to kind of rush to the most extreme measures, and insist that a person check them into the hospital when their the severity of their suicidal thoughts may or may not warrant that. So I've just talked with so many people who have been suicidal and have struggled to find a place where they can deal with that in a way where they feel like they maintain their autonomy and their dignity, and don't feel like they're suddenly like the person they're talking to suddenly just sees risk
Hmm.
in front of them, and okay, I'm going to manage this risk, and sometimes asks them to do nonsensical things like, I need you to sign this form promising you're not going to kill yourself, which obviously, I mean, that
Wow.
is not at all rare. I was actually, I think I think early in my training, before I actually um, was practicing, we were taught you need to get the person to contract for safety. Like that was the idea. Well, did they sign a contract for safety?
Oh my goodness.
And anyone knows that that is a total CYA measure. Like that, the only reason that a person is doing that really is to, I mean, maybe a person can say, well, I'm really doing this because I want them to protect themselves, but it has such a legalistic feel. Like if anything happens, all right, that's on you because you promised, and you say
Right.
here it is. They signed this form. So I know this is a long
That's
answer
that
to your
seems so hard to
question.
believe. Like, someone expresses this feeling and someone puts a piece of paper in front of them, that I'm not sure how that is supposed to help that actual person who's in that situation, but
Well, yeah, I'm glad to hear you say that because I think it's exactly right. I think it's a dehumanizing response because I don't know if we're ever more human and vulnerable than in those moments when we confess to someone that that we're thinking about ending our life, and to be met with that kind of like you said, a piece of paper, like, okay, I've got just the thing for that here. Why don't you fill out this form? That's, yeah, it's very distancing and alienating,
mm,
and some of the, I think the most helpful response we can give someone who is in that position, I think, is to just treat them like a human being who's suffering and not like a liability.
certainly. What would be, I mean, you mentioned that even clinicians who have training in these kinds of issues have trouble figuring out the right way to respond. So if you are not a professional, if you're someone's friend or family member, do you have any tips on things people could say or next moves or even just, how to check in on that person going
Yeah.
forward?
Yeah. I think the primary thing to keep in mind is to focus on the person's well-being, like to emphasize, like, I'm really concerned because I this is such a clear indicator of how how miserable you are, of what a state you're in to have reached this point. So I'm really glad you told me, and I want to make sure that you find the relief that you need, so you don't feel like you have to resort to killing yourself, um, rather than a response that is more about, oh my god, like, are you that just focuses on, like, I want to make sure that you don't do this, which again, even if we're just talking to a loved one, that can really miss the point of, like, what I really want to communicate to you is I am so despairing of things ever getting better, that that exiting life seems like my only option. And uh, so uh, beginning with that emphasis. And then I think it is important to, in as human and connected a way as possible, to assess kind of the extent of the threat. So if someone says, I've thought about killing myself, that can mean all kinds of things. It could mean, like, I had a passing thought about it, but I would never act on it. It could mean I've thought about it, I want to do it, and I'm trying to get the means to do so. So there's this progression from thinking about it, which may or may not involve wanting to do it. So that would be the next step, is a desire to die. And then, but a person might want to die, but say, I would never do that to my family, or I have other reasons why I would never kill myself. But then the step beyond that would be planning. So you want to assess, like, okay, so you do want to die. You've thought about killing yourself. Have you thought about how you would do it? Have you put any plans in place? And then the next step after planning often is an attempt. So, and then of course, a lot of people attempt suicide, and most of them, thankfully, do not end up in completed suicide, but many do. So we want to get a sense of the level of risk for the person, and if they feel like they're an imminent danger to themselves, because then we may need to take more serious steps. And in the more extreme cases, if a person really does seem like they're not sure that they're going to be safe, and they can't. I mean, no one can say with 100% certainty, I would never do anything. That would kind of get back to that contract. You need to, promise me you'll
Mhm.
never do anything. But if a person says, no, I'm not concerned I'm going to do anything between now and next week, when I come back to therapy, or, between now and tomorrow, when, at the end of the day, when you come back from work, then we may not need to take immediate steps. But if a person doesn't have that level of confidence, then it may be an appropriate time to call 911, or to take the person to the emergency room, and you know get them in a place where we know that they'll be safe for long enough that they can get to a better place where suicide is no longer what they're planning to do.
Right. Good steps to keep in mind if you ever find yourself in this situation. I think we've touched on this a couple of times, but I want to be clear on the difference here. What is suicidal ideation? This term you hear sometimes. Is that the same thing as what people would call suicidal thinking, or does it mean you are actively planning to end your life?
Yeah, it's a great question. I mean, in my mind, it's one of the ways that psychologists, or whoever came up with the term, tend to use words that complicate things rather than make them clear. So
Hmm.
it's really just the same as suicidal thinking, but I don't know if it sounds more official or something. But ideation just means thoughts, thinking, and it can range anywhere, all along that spectrum that we talked about earlier, from just kind of thinking about it in passing, or wondering, gosh, what would it be like if I ended my life, all the way to more serious steps in planning and getting ready for it.
I see. Okay. So it's quite a spectrum, it sounds like.
Yeah.
Okay. When someone says they don't want to be alive anymore, as a psychologist, do you see that as the same thing as they're saying they want to be dead?
Well, not necessarily. And again, that's why it's really important to check out with people exactly what they mean by the words they're using. Sometimes they just want the pain to stop. And for them, being alive equals pain. And so not wanting to be alive really just means I don't, that would be a way to make the pain stop. Or maybe they see their life as being a net cost for others. I remember at the worst of my depression, just saying to myself, like, my kids would be better off without me. And that actually, I mean, I was not so far gone in my depression or suicidality that I couldn't see through that thought and say, wait a second, that's exactly like the thoughts that people have said to me when they were suicidal. And I could
Hmm.
see so clearly, like, that is so false. Like, that is patently false. Um, And so even though it felt true at the time, I could recognize like, wow, that is a really depressed way of thinking. That's how a suicidal person tends to think.
Hmm.
But it is, I mean, it's a scary thing how depression and suicidal thinking can kind of hijack our minds in that way and really make us believe that this drive towards death is our own and is somehow for the good of all.
Right. Presenting you or, this alternate reality that seems very compelling that would, make you think that everything, thinking that way was true.
Right. Yeah, like I've done the simulation in my head, life with me versus life without me. Clearly, life without me is better. I mean, thankfully, there are some people who just, for the most part, don't seem to go there. No matter how dark things get, there's like a door that's hammered shut, and say, "No, I've never thought about that. Never considered it." And then there are others of us, and it tends to be somewhat. I mean, it tends to run in families. There seems to be somewhat of a genetic component to it, where when things get really dark, that door opens, and we think seriously about it.
Right. And to that point, I mean, how much more common do you think it is to have thought about suicide compared to people who actually attempt it?
Yeah, well, again, that's it's not at all uncommon to think about suicide. The numbers that I've seen are around 12 million people a year will have suicidal ideation. So
Wow.
yeah, that's a large percentage. I mean, that's in the US. So that's a large percentage of the population. And there are about 1,400,000 attempts. So I think that's
Hmm.
about 12% of those who think about suicide will attempt suicide. So that is, I mean, that's a huge risk compared to, just the base rates in society for suicide attempts. That 12 out of 100 will who think about it will attempt suicide, but by no means the majority. So again, it's a good reason why we don't want to rush to lock everyone up, so to speak, who says they've thought about suicide. And then of those who attempt suicide, about 3% will complete suicide for a given attempt. And so that's about, I think you mentioned this, around 48,000
Hmm.
suicides a year. So at the extremes then of those 12 million people who think about uh, suicide, about 4 out of 1,000 will end up completing suicide within a given year.
It sounds like you've had personal experience with this suicidal thinking and depression and these kinds of things. And it's great to hear that you've been able to come through that, by the way.
Thank you.
So maybe you can offer some personal perspective here. How does someone come back from a period like this?
Yeah, I think first and foremost with love and support. I think those are the most important things that we can seek out when we're struggling in this way, and the most important things that we can offer to those that we care about, and those that we care for. If we're clinicians. My trip back included some good treatment, which was, I guess, I mean, I had medical treatment because I was going through a lot of medical illness at the time, which had a lot to do with my despair. But on the psychiatric side, it was I wasn't so concerned about um, my depression that I needed uh, treatment for that specifically. Although I was prepared to seek that if I did, but I did self-directed treatment, the kind that I lead other people in. So I did a lot of work examining the thoughts I was telling myself, and getting more involved in activities that brought reward, and started to lift the depression over time. Um, for a lot of people, their recovery may involve medication. It's not necessary for all, but a lot of people will find that helpful and even life saving. And then, one way or another, I think we start to find hope and kind of want to know what the rest of our life holds, and 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 maybe eventually we come back to a feeling of excitement about our lives, but at least we can get through the acute pain in a way um, that it makes life more appealing, less intolerable.
Do you find that this period of your life, this experience of having lived through something like this, does it help you talk to your patients who are expressing similar feelings about, despair or hopelessness?
Yeah, yeah, yeah. That's such a good question, Carrie. Definitely. I think it's I mean, we can imagine what it's like to be in someone's shoes, but until we've been in them, it's hard to really know what that's like, to know kind of the range of reactions that we have to those types of thoughts. Like there can be shame around them, like I shouldn't be thinking this way, and um, or embarrassment to admit that. Maybe it seems like a weakness or something, even though it's nothing, has nothing to do with weakness to think those kinds of thoughts.
Hmm.
And um, and also I think recognizing the kind of um, I mean, what a how depression and the thoughts that come along with those darker mood states, there's kind of there's a feeling that I can relate to now, that other people have described, and now I really get it. It's this sense of that despair being kind of like, I mean, for those who have read the Harry Potter books and remember the
Hmm.
author's descriptions of the Dementors,
Hmm.
that's I think I didn't realize really until this moment what an apt description of depression that was. I knew that I believe that it's related to her own experiences with depression, but that feeling of this malevolent entity that will suck all the life from you, and it's really a beast, and it's
Hmm.
this beast that if it gets too big, it can kind of claim you
Hmm.
beyond redemption, beyond the point where you can come back. And so that has certainly motivated my as I work with people, helping me to really emphasize, pulling back from those states, is doing everything we can to step back from those states as soon as possible, because at some point, there is this gravity that it takes on that can become rather irresistible.
Right. I had forgotten about that description from Harry Potter, but now that I'm thinking about it too, it does really seem to fit just perfectly in how in that kind of thinking that can overwhelm you when it comes to something like these, dark, depressing, excuse me, thoughts.
Right. Yeah. Yeah. Those thoughts that make it seem like suicide is not just not a bad idea, but is actually a reasonable response to circumstances. I mean, that's the level of kind of hijack of our thoughts that we've experienced, because it does just seem so bleak, and like things will never get better. But
Right.
thankfully, yeah, there is reason to hope. There is reason to resist those most hopeless voices. And even if we don't believe it ourselves at the time, to find people who, for long enough can hold the hope for us, and long enough that we can come back there and find hope of our own.
I can imagine a situation where someone does, end their life, and someone that they were talking to, a family member or friend, maybe they knew they were depressed and struggling, maybe not, but they probably hold on to such a sense of guilt, such a burden of, thinking that they should have stopped that person from taking their life. What are, what are your messages to somebody who might be having those feelings?
I'm so glad you asked that, because it is so common. I know for myself, when I've lost someone to suicide, I know that it doesn't make sense to blame ourselves, and yet it's so hard not to. Like, our minds just automatically go to that question of, was it something I did, or probably more often, is there more that I could have done? And I remember, my I mentioned the suicide in my own family. It was my dad's father, and he, blamed himself for years as a young man for his dad's suicide. And when I lost a friend of mine to suicide, and I mentioned that to my dad, and wondered if said, I of course wonder if I could have done more. And he said that, the answer to that question is yes. There's always more we could have done, but that's not the reason that the person killed themselves. And I found that so liberating, because it's not like, well, if I could have done more, then this person would still be alive. Because again, as we discussed earlier, suicide takes on such a power of its own. And when a person is really committed to doing it, there is almost nothing that will stand in their way. And often the person will be quite secretive about it, or maybe they've mentioned suicide so many times but have never acted on it, that we never know. They can't live their lives in a hospital ward, and so we're trying to balance, if it's a loved one, or a an adolescent. Trying to balance, allowing them to have a life, and find some joy in living, versus keeping them safe. And so these, we make the best decisions that we can. And I think none of us should blame ourselves for when a loved one ends their life. And I know that most of us probably will when that happens. And so when it does, I think it's so important not to keep those beliefs inside, to talk to others who can see you and can see through that belief, and can understand where it's coming from, while also talking, talking to you in a way that can help you see that, just like my dad did for me, that um, maybe the person's suicide had everything to do with them, and really did not have to do with us.
Right. That is a good piece of advice uh, that your dad gave you there. They were, it's not like the one thing that you didn't do was, the reason for that person's death. So,
Yeah, and I should just add, a senior colleague told me this, and I found it really helpful. He said that, as this is, for clinicians who've lost someone to suicide, there's so much there's so much blame placed on mental health professionals, as if, if someone is in treatment and kills himself, then someone must have messed up. But this person said, we accept that in, with medical conditions like heart disease, kidney disease, there's a mortality rate. And tragically, there's also a mortality rate, in with mental illness, by suicide. And we want to do everything we can to prevent it, but also recognize that we don't have the ultimate power to do that. That we are, this is a high risk um, condition that we're treating, and so we shouldn't imagine that someone's suicide, that we were caring for, must mean that we failed in some way.
right. Yeah, that's an interesting comparison to other fields of medicine. One more time before we let you go, I just want to be sure we're very clear for anybody who's listening who who has contemplated ending their life or thinking about it currently. What are the steps that they should take?
Well, I mean, if there's no one that you can talk to right there, I mean, um, there's suicide. There's a suicide crisis line that's easy to find. I mean, I think any Google search for suicide will bring that up.
Hmm.
Um, you can call or chat with someone 24 hours a day, 7 days a week in the
Hmm.
U.S.
The
Um,
National Suicide Prevention Lifeline.
yeah, yeah, exactly. And but talking with someone, and if the I mean, talking to someone right away, if as soon as possible. And if it is an emergency, I mean, also, calling 911 is always an option,
Hmm.
or asking someone to go with you, or take you to the nearest emergency room.
What if it's a very young person, a teen or even younger? Is it the same kind of process?
Yes, I mean, in general, it's the same process, but it will vary by. I mean, there are different rules about consent and that kind of thing. Depending on the child's age and the state that they live in. Um, so, but I mean, I think that may complicate things for those who are not clinicians. I think the important thing is just to follow similar steps to ensure the person is safe.
That makes sense. Seth Gillihan, thank you so much for joining us today and sharing all of your thoughts around this so important topic. We really appreciate your time.
Carrie, thanks again for having me.
Thanks again to everyone for joining us today. And before we let you go, please don't forget to subscribe, favorite, or follow Health Now on your favorite podcast platform. That way, you'll know when our latest episodes go out. Plus, you could rate us and leave a review too. Hope everyone has a great week. We'll talk to you next time.